The American Heart Association Bernard James Tyson Impact Fund is all for the love of Bernard and what he stood for. We're looking for organizations, community-based organizations that are authentic, that are already working on the ground in the communities where they live and serve, and looking at helping those organizations to scale their business models to serve more people, but also to look at where some of those models might be replicable in other communities.
As the COVID pandemic was spreading across the U.S., we saw that there was a need for acute care hospital beds. And so the goal really was to implement a program that would allow us to help increase the number of hospital beds available to care for COVID patients by helping to provide access to preventative health services for unhoused, marginally housed, low-income individuals here in Oakland, California. I think that the biggest impact really is being able to engage individuals that are often overlooked.
At the Knowledge House, we empower and sustain a talent pipeline of technologists coming from low-income communities. We provide job training in the areas of code and design, and we provide these programs to high school youth as well as adult job seekers. For a lot of startup founders, especially entrepreneurs of color, fundraising is challenging. With support of the fund, we'll be able to increase our earned revenue and think of new business lines that we can offer community members during the pandemic.
The mission of New Destiny is simple. It's to end the cycle of violence and homelessness for low-income families in New York City. The work that we do around housing is about housing equity and the intersection of health and housing. You know, people can't seek the health care that they need when they don't have a place to live. What this fund has allowed us to do is to think outside of the box. The fund will allow us to essentially create a multiplier effect on the work we're doing to house families in the community.
Consejo Sano is a patient engagement and patient navigation company. And what we do is that we focus on helping low-income and multicultural and undocumented and other underserved and hard-to-reach patients. We focus on helping those folks connect to healthcare. We need a healthcare system in the U.S. that works for everyone who calls this country home, regardless of what they look like, what they talk like, where they come from, or what their income is. I think one of the key benefits that we're seeing is that when you treat people like who they are matters, they will engage.
The benefit of investing in leaders of color that are creating solutions for their community is that they offer an authentic perspective. And through that perspective, they usually offer more holistic solutions that lead to economic empowerment. I think very often in underserved communities, it's hard to meet everyone's needs, but it starts with health.
The Bernard J. Tyson Fund is more than just money. It's an opportunity for us to help lift up the community. It's an opportunity for us to dare to be different and envision healthcare differently and to redefine how healthcare is delivered.
It's really important to have funders like the Bernard Tyson Fund who understand that there is a huge need for better solutions to serve low-income and underserved people in the country. Talk is not enough. That if we don't produce equitable outcomes, we need to keep working